Medical Information and Current Drug Therapy, Chapter 4. Here are the key terms for Chapter 4. We have aggregation, agranulocytosis, blood dyscrasia, leukopenia, neutropenia, postural hypotension, and thrombocytopenia. The chapter introduction begins with asking the patient, are you now under the care of a physician? If yes, what condition is being treated? A positive response will determine what medical condition the patient has and will also determine if there are any treatment modifications. Will determine the risk for medical problems arising during dental treatment, the potential adverse drug side effects, the potential for cross-contamination in the dental office from the medical condition. Will there be any interactions if we use a local anesthetic? And will there be any interactions should we recommend oral analgesics such as Tylenol, ibuprofen, and others? Additional questions that should be asked of the patient: are you in good health? Has there been any change in your general health within the past year? The date of your last physical examination? Have you had a serious illness, operation, or been hospitalized within the past 5 years? You want to note any complications if they have been hospitalized, such as infection, prolonged bleeding. Did they have a blood transfusion? Will this patient need antibiotic coverage prior to a dental appointment? The medication history. You want to ask your patient if they are taking or have taken any prescription or over-the-counter medications. The medications taken should be reviewed. It is noted that medication errors have increased 2.6-fold from 1998 to 2005. It is estimated that medical errors cause at least 1 death per day and injure at least 1.3 million individuals yearly. It is important to find out any dental implications with medications the patients are taking. When checking a patient's drugs, it is important to know the following: the specific action of the drug. Does this affect healing or increase bleeding? Will the dental treatment plan need to be, will it be affected? The dosage of the medication the patient is taking, and typically an increased dose means that there will also be an increase in the side effects. Side effects relevant to oral changes or to treatment modifications may include dry mouth, candidiasis, which is a fungal infection, an increase in blood pressure, postural hypotension, which means when we raise the patient up from a supine position that their blood pressure will typically drop, and then also neutropenia, which we'll talk about in a slide coming up. Continuing with medication history, there are interactions between the patient's drugs and the drugs used during oral health care. There are interactions between the patient's disease and the drug likely to be used during oral treatment. So some dental treatment considerations would include: we need to know the medical condition that requires the drug use, interactions with drugs used in our dental treatment, and what are some relevant side effects of the drug. Herbals, vitamins, or supplement use. Typically, patients tend to take vitamins and supplements as a form of self-medicating themselves. Reports of adverse effects from herbal supplements that can be relevant to oral health care include: niacin can affect postural hypotension. Cava and valerian, as well as St. John's wort, can interfere with sedative drugs, and typically patients take St. John's wort as a natural antidepressant. Ephedrine and golden seal are known to affect hypertension, arrhythmia, and tachycardia. Ginkgo and ginseng, as well as high doses of vitamin E, have been known to affect bleeding and cause an increase in bleeding when there's treatment. So just remember, vitamins and supplements are still considered a medication. So this is a chart that's also in your textbook, and it lists some of the drug side effects and treatment indications for each. So for postural hypotension, remember this is when the patient's blood pressure is going to drop from changing positions from either a supine position to an upright position, or when you have them leave the chair to standing. So you want to make sure that you raise the back of the chair slowly. The patient should typically sit in the upright position for a few minutes before standing, and this is typically a good time when we, as the hygienist, will be doing some chart work and things like that before we release the patient. You might want to check their blood pressure before dismissing the patient to ensure that their blood pressure is back to normal. As the patients leave, you should also stand nearby for support. Bleeding. Anytime there's excessive bleeding, you want to make sure you apply digital pressure to encourage clot formation, and if necessary, you can use a local hemostatic agent if the bleeding is more severe or continues after the digital pressure. Hypertension or arrhythmia, you want to make sure that you monitor those vital signs for normal limits and inform the patient if it is in excess of 110. Nausea, vomiting, or GI reflux. For these type of conditions, make sure that you place the patient in a semi-upright position for treatment. A supine position may aggravate especially the GI reflux, and the person could experience some nausea and vomiting from this. Leukopenia or thrombocytopenia, you're going to watch for increased infection, also monitor for delayed healing, monitor for excessive bleeding that doesn't clot, and if necessary, you may need to request a complete blood count if blood dyscrasia is suspected. Prevention and management of postural hypotension. So this is just a little bit more detailed than the chart. So for prevention, remember, prevention is the key in any type of medical emergency. So you want to raise the dental chair back slowly, have the patient remain in an upright position for at least 2 to 3 minutes before you allow the patient to be dismissed. And again, this is usually a time when we're doing some chart work and things like that. We're talking to the patient about their next appointment, so leaving the patient in the chair for 2 to 3 minutes is usually not an issue for us. You also want to measure their blood pressure before you let them leave the chair to ensure that their blood pressure is somewhat back to normal. So if they develop postural hypotension, then you need to manage it. So then you would want to place the patient in the supine position, assure that their airway is open, breathing and circulation are all okay. Look for signs of recovery while you're checking their blood pressure. And typically when the blood pressure is above 80 systolic over 60 diastolic, the patient can stand without any further lightheadedness. And you want to make sure you record the events of the emergency in the treatment record, and also you want to make sure you note the duration of the event or how long it lasted. Increased bleeding. Sometimes there are some drug side effects that can affect bleeding. One would be platelet inhibition, and aspirin or ASA is an over-the-counter medication that does affect platelet inhibition and can cause increased bleeding when we are treating a patient. Reduction of clotting factors. So this is an anticoagulating effect. And again, this can interfere with our treatment plan. If a person has thrombocytopenia, this thrombocytopenia is a decrease in the number of platelets formed in the blood in the bone marrow. So again, this can interfere with our treatment plan. Aggregation, and then there are some specific drugs such as Coumadin is the brand name, warfarin or warfarin is the generic name for a specific drug that increases bleeding. Plavix, Plavix, and Equanil, Equanil, are also some specific prescription drugs that are used to thin out the blood. So if we do have increased bleeding, we want to stop the procedure, apply digital pressure first to ensure that the bleeding will stop, and if not, we may need to provide some local hemostatic agents to the area. Just as a side note, when patients are taking some of these medications, especially Coumadin, there are certain foods that can interact with Coumadin, such as cranberry products and grapefruit. So if they happen to be taking Coumadin and they take it with, say, grapefruit juice, or they eat a grapefruit, or they drink some cranberry juice when they take their medication, that will actually cause the bleeding to be worse. So you might want to question your patients to ensure that they're not doing any of that. So we want to prevent uncontrolled bleeding. So we want to make sure that when we're treating your patients, they're not going to have excessive bleeding. A lot of times, again, patients are taking anticoagulants, and these are also known as blood thinners. And so there's some lab data that we may need. PT stands for prothrombin time, and then INR is the internal normalized ratio. And it is now standard to ask for an INR over the PT. PT, or the prothrombin time, can be different from one facility to another, so we have to have the actual scale that their facility is using, whereas the INR is standard across the board from one facility to the next, from one doctor's office to the next, from one hospital to the next. So we typically want to get an INR on patients who are taking prescription anticoagulants. So if they come back with an INR of a range between 2 to 3, then that is a good range for our patients. If it's below 2, then that means they're clotting faster than probably their physician wants them to, but it's still okay for us to treat the patient if the INR is below 2. If it's above 3, it can cause, if we're working on a patient, it can cause a lot of excess bleeding. So if it's over 3, we don't treat the patient. Blood dyscrasias. Thrombocytopenia is a blood dyscrasia, and the formation of platelets are inhibited in the bone marrow, causing thrombocytopenia. Whenever this is listed as a side effect of a medication, we want to do our best to prevent any type of medical emergency. So prevent, prevent, prevent. We want to monitor. We want to make sure there's clot formation, and we may have to use some type of local measures to ensure that there's not excessive bleeding. Management of uncontrolled bleeding. When you first begin to treat patients in the dental hygiene clinic, you may not be truly aware of whether you have an excessive amount of bleeding or what is really just typically normal. So in this situation, if you happen to suspect that you have a patient that has excessive bleeding, be sure to let one of the instructors know first, and we can assess the situation. But if you do have a patient that does have uncontrolled bleeding, you want to stop the procedure immediately, assess to see if there's any clotting going on. If there's clotting, typically that's okay. If the person is not clotting, then we need to do something rather quickly to get the patient's bleeding under control. And the first thing after we have assessed the patient would be to apply digital pressure. And we want to apply digital pressure with some 2x2s or gauze that we typically call gauze 2x2s. So with applying the pressure with the gauze, you want to leave it there for a few minutes and do not look to see if it's continuing to bleed. You need to leave it there for a few minutes, applying the digital pressure before you look. So after you've applied digital pressure for a while, then if it's still bleeding, we can apply local hemostatic agents such as gel foam or tannic acid. We can also administer local anesthetic, which has epinephrine in it, particularly epinephrine that's 1 to 50,000. So if we use a local anesthetic that has 1 to 50,000 epinephrine, that will get the bleeding under control. For the most part. If we still have uncontrolled bleeding, the patient must be evaluated in a medical facility and treated accordingly. Hypertension, hypotension, tachycardia, and arrhythmia. So when any of these conditions are listed as side effects, we want to evaluate the blood pressure and pulse rate. Antihypertensives, which are used to treat people who have high blood pressure because of how they are, will naturally cause a decrease in blood pressure. So again, we need to make sure we check that. If they're taking some decongestants, such as Sudafed, pretty much anything for sinus, that can increase their heart rate. So we want to make sure we're checking the pulse. So drug side effects can affect the blood pressure and cause it to either drop or be elevated. So we want to make sure that we check on that. So hypotension is typically going to occur if the blood pressure is below 80/60 millimeters of mercury. So we want to try and prevent an emergency, and typically patients tend to have a medical emergency following a local anesthetic injection. So we want to make sure that we limit the vasoconstrictors, which is the epinephrine, with our injections. So that is unless they're bleeding, of course. So then arrhythmias will be the most common sign that occurs before a heart attack occurs. So we want to make sure that we're noting the pulse rate and making sure that it's steady and not irregular. So for hypertension, if the person does have hypertension, typically it's really going to be a concern, and this is in the textbook, if it's 180/110, the person needs to have a medical evaluation immediately. Now our blood pressures in the clinic are going to be different because we're treating there's going to be several of you in there, so we're treating more patients at one time. So for our blood pressure limits in the clinic will be 164/96. Nausea, vomiting, and GI reflux, or gastrointestinal reflux. Antibiotics are typically known to cause nausea. So typically that is a common side effect of antibiotics. You don't really necessarily need to change the antibiotic unless the nausea and vomiting become extreme or severe that the person is not keeping the antibiotic down. Reflux can both be a disease, so a person can have acid reflux, or it can be the side effect of other medications. So it's important to try and figure out which one the patient has prior to dental treatment. If a person does have any of these signs or symptoms such as nausea, vomiting, or reflux, it is probably best to keep the patient in a semi-upright position. If you put them in the supine position, you need to monitor the patient closely, and if they start experiencing the reflux, you will then need to sit them in a semi-upright position. Leukopenia, granulocytopenia, and neutropenia. Anytime you see the suffix P-E-N-I-A, penia, that typically means like a decrease in or a reduction in. So leukopenia is a decrease in the number of white blood cells. A granulocytopenia is a decrease in the number of polymorphonuclear leukocytes. And again, that's a decrease in the number of polymorphonuclear leukocytes. And then neutropenia is a decrease in the number of neutrophils. So again, these are all considered blood dyscrasias, and blood dyscrasias can be a side effect, although it's rare, it can be a side effect of some medications. So these can occur from inhibition of the bone marrow function or a sensitive or hypersensitive reaction to a specific medication. All of these conditions can result in an increase in infection and a decrease in healing. So when you're looking at the oral tissues, you want to make sure you examine those tissues. If you notice any type of infection in these patients, you do need to get a physician consult. Non-emergency oral side effects. Xerostomia would fall under this category because it's not an emergency situation. Xerostomia is typically a side effect of many, many drugs. There are probably almost every patient you see that is on a medication probably will have xerostomia listed as a side effect. So xerostomia is dry mouth, and it's not just your normal dry mouth. It's typically an exacerbated condition. So anytime a person has xerostomia, it can lead to other oral diseases. And some of those include fungal infections. It also can cause an increase in dental caries because the person doesn't have that natural salivary flow to wash away the bacteria and the sugar. And it can also lead to poor, ill-fitting dentures. So xerostomia can be a contributing risk factor for a number of oral diseases. The treatment for xerostomia, typically you want to put the person on xylitol. So xylitol is a sugar alcohol that prevents the bacteria from having a nutrient source to grow. So xylitol is in gum, mints, and those kind of things. In order for it to be protective, xylitol has to be listed as either typically the first ingredient. You also would like to put your patients on home fluoride. Again, because they're going to be at risk of developing carious lesions or cavities, the home fluoride will help prevent that. If they do end up getting candidiasis or a fungal, which is a fungal infection, you can put them on antifungal meds, and typically the one that we in dentistry tend to administer is nystatin. Nystatin will come in a mouth rinse that the patient can use to help ward off the fungal infection. So that concludes Chapter 4 of your textbook.